unless you can actually, and it's hard to do and actually, if you can't actually get together. Can you hear me okay? Okay. So, it's created a unique challenge. And when I started working with the senior agenda in early March, I was reaching out to Ray Gagne. Pardon me. Ray Gagne is the head of Rhode Island Organizing Project. And I was saying, how's the organizing going? He said, it's been virtually impossible, but in fact, virtually possible, if you know what I mean. So it's like, but it's been very difficult. And we couldn't rely on calling meetings together where people could openly discuss. We had to use this new technology of Zoom, which we're using today, of course. And I'm really glad to hear that you have returned to meeting together, and you'll be doing that again in September, because I think that's really important that people do get together again. But to acknowledge the experience of the last 2 years, I just want to reflect on some thoughts. Gone have been the soft touches of interpersonal interactions before meetings, the small chat, at worship services. It seems as the pandemic has its ups and downs. We've had to condition ourselves to hold back, or it's okay now to hug or don't hug. Handshakes had been replaced by elbows and fist pumps. Not quite the same feeling. Something very different in our culture, trying to continue a very human need, which is human touch. Facial recognition and communication has been stymied with masks. How do you see the broad grin behind a mask, the little smirks, the cues we get naturally to know that we understand each other? I think you've all heard the truism that 80% of communication is nonverbal. When people are communicating, they're communicating by their looks, their reactions, their facial expressions. So we've lost that opportunity. Now we're getting it back, but it's to acknowledge that we've been through a tough time. I remember a dentist appointment I had in 2020, and I was really trying to avoid it at all costs because of COVID and all of that, but it was, I had a toothache. And my dentist came in a spacesuit. And she had their own backpack, an oxygen pack. And I said, well, okay, now I'm in space getting my tooth fixed. It was the feeling I had. Not being able to hear people because they're behind muffled masks. Okay, so then you put the mask on. If you have glasses, you fog up. Not only can you hear somebody, they're foggy. Frustrating. This is what we've all lived. We've adapted though. And this technology that we're seeing, 3 years ago, no one knew what Zoom was. And I think unless you were in a very active kind of business environment, you really didn't have this kind of virtual connection. So we've managed to stay connected in this way, but it's been difficult. We cling to the hope that we can be together again without anxiety, without worry of spreading disease. But the good piece in all of this, social suffering, I guess I would call it, is we've come to appreciate how important we are to each other, that we truly miss each other's company, even if it is to sit next to one another, not say too much, but to be present. In learning that we've missed that has been a good thing. I think it's been an appreciation for the basic human element that we all need and all desire. So I kind of wanted to share that as a context. We've had to adapt to new ways to communicate. What's not negotiable is that we're not going to give up on being a community of people. It's evident in your community that I'm looking at now that you have not given up on that. And We've had to fight harder to keep it because of the pandemic, but it looks like better days are ahead for sure. So in this context, given the year where we have many candidates for governor, and one of the traditions of the Senior Agenda Coalition has been to have legislative forums. In 2014, under Bill Flynn's leadership, they had a gubernatorial candidates forum, and Sue's husband, John Glasheen, was a key organizer for that. And it was very successful in that many people show up, and there were very pointed questions that the candidates had to respond to. So that was 8 years ago. So the question was, can we do it this time? Will we be able to kind of get past the barriers of communication, the limits to meetings, to be able to organize that thing? So we made the attempt. The approach we took was to take a look at who are all the stakeholders in the question of how do we better serve our senior population? How do we, as a state, take care of our older Rhode Islanders? Many times I worried in small meetings that I had to have about continuing to spread the COVID. So it was a difficult process. And just as a personal note, at the same time, since March 1, when I began the job, in my family, my wife Rosie's 95-year-old mom was in failing health. As we lived close, Rosie and I were part of her end-of-life care. So, some of the issues that we're talking about in terms of long-term care, I was actually experiencing in a very personal way. We spent nights sleeping there, taking care. Rosie's sister was the daily caretaker, but she needed a break from time to time, and we were part of that care. All the time concerned in my outreach for organizing for the forum that I don't bring the COVID germ into the house because mom was so vulnerable. So that was tough. Throughout April and May, I was called to testify at the State House before the state legislature. I continued to be concerned about COVID. As everyone was, we took precautions where we could. I avoided crowded rooms, submitted written testimony, in some cases, in-person testimony when the room was not too packed. And the Senior Agenda Coalition was supporting a number of bills, very important, having to do with a whole range of services for seniors, but improving long-term care in particular, meaning home care and nursing home care in particular, and assisted living. The focus, we had a focus on the workforce conditions of home care. Now, we have all heard that trying to get home care for ailing elders has been extremely difficult. Going through the pandemic, a lot of people opted out of that profession. The pay is too low, $13.87 an hour on average. And all these home care agencies just didn't have the workforce. So this is a crisis continuing for the state of Rhode Island. And we worked very hard to advocate for increasing the wages for home care workers. And in fact, we did. I think you're aware of this problem. I would imagine you would be aware of this problem. But at any given time, there are hundreds of seniors in our state that are waiting for home care assistance. So that was a very important issue. Again, on a personal note, Rosie and I, in taking care of her mom, realized at some point, we needed some professional help to come on in. We couldn't handle all the needs. And so we contacted the East Bay Community Action Program, very professional organization, and we began the process of finding a CNA home care worker. Unfortunately, that process took 2 months. Rosie's mom passed away a few days after a CNA was assigned. Too late. That, you know, in the meantime, we were able to find a referral from a friend of someone who used to be a CNA, who left the full-time profession really to diversify her work and her income potential, and she helped a great deal. So it's not like we didn't have help, but the system was not providing the help. So that issue became one of the important issues for the forum, you know, that we're organizing. Just check my time here. Great, good. So we held the forum last Wednesday, August 3rd, and we were able to organize 18 organizations. Now, disparate organizations. We had the Nursing Home Association, which, you know, going back a year, Senior Gender Coalition was sort of at odds with them because we were pushing raising the bar legislation, which would improve the standards in nursing homes. Because as you all know, in nursing homes, there were a lot of COVID fatalities, and part of it was due to the quality of care and a lack of staffing. So a year ago, in 2021, we were able to get legislation that put a mandate on nursing homes. As you may know, nursing homes have said, we don't have the resources to do it, we need help. So we, Senior Gender Coalition, had to take the position of nursing homes are an important part of the continuum of care. Some people, not all people, may need a nursing home. I know personally my parents did before they passed. So nursing homes are really part of the whole equation. And so in organizing this conference, we reached out to that industry, we reached out to the assisted living group, we reached out to the home care agencies, we reached out to daycare providers, adult day providers, and a number of other organizations that work for and advocate for seniors. And we found a common purpose. We got over our differences and said, collectively, we need our candidates for governor to understand these range of issues, to take them seriously, and to really build that into their policy platform for the future. So we built this broad coalition, and we had several meetings in July to Zoom meetings to say, well, what are the issues? And after much discussion, we came up with 7 key questions. One of them was about the healthcare workforce. We found common ground. So it reminded me of a powerful thing in community organizing. And it's just a statement from a sociologist, anthropologist, Margaret Wheatley. Margaret Wheatley once said, there is no power for change. There's no power for change greater than a community discovering what it cares about. So we became a community. Our 18 organizations became a community in and of to itself. We knew what we cared about, and therefore we had power. And the power we had was to kind of bring the candidates to the table and have them really respond to the questions. Quickly, the questions. Number 1, what action will you take? Excuse me. We good? Yeah, what action will you take to rebuild and sustain a viable workforce for nursing homes and home care? Number two, what is your plan for Medicaid rebalancing so that we balance between nursing homes and home care? Number three, what will you do to increase resources in the community? How will you support senior centers? How will you support transportation services for seniors? Number four, how will you help low-income seniors have more income? Two specific things: increasing the supplemental payment in SSI. Another one is Medicare savings programs. Number five, how will you ensure adequate senior housing, affordable senior housing? Number six, how will you commit to doing a better job in terms of the racial disparity and health inequity? And number seven, what is your master plan? Are you committed to doing a master plan for aging in Rhode Island? In a few years, 1 out of 4 Rhode Islanders is going to be 65 years and older. We're a huge part of the population. And by the way, 60 plus represents 42% of the vote. So we're a huge voting bloc, right? At least in 2020, 42% of the votes that were taken by people 60 years and older. So we are a political force. We are an important constituent entity. As it turned out, the candidates spent 90 minutes answering questions, no breaks. To a candidate, everyone took these questions seriously. They gave thoughtful answers. There were some variations on the theme, but I guess what our goal was to create the agenda for the next governor. And whoever the next governor is an agenda, and it's pretty clear. And the agenda was built by this community who spent time discovering what it cared about. So on a higher level, what do we hope to be doing with this kind of work? And I'm brought to the concept of the beloved community that Dr. Martin Luther King preached about. He talked about, and it is a community where everyone, our children, our moms and dads, our elders, aunts and uncles, are cared for by each other and are absent of want and suffering and embraced by each other's love. So fueled by our faith in our Creator, ourselves and each other, I believe and we believe that such a beloved community is possible. In fact, it's going to happen. So those are my thoughts on kind of the work in coming through the pandemic and what I think was a very positive outcome from the forum. Where we go from there, of course, is to continue the dialogue. We want to take our time and build a constituent support behind all of these ideas so that we can improve things for all Rhode Islanders, especially our elders. So thanks for listening. I'm very happy to entertain any questions if that's part of the agenda. Appreciate it.
Thank you, Bernie. Okay, and I just want to mention that after the service, we do continue on Zoom and have sort of an informal, what we used to call coffee hour, or just a sharing, so that a feedback, a sermon reflection. So Bernie's going to stay around and answer any questions that people have. So just remain on the Zoom call after the service. Now it's time for our closing hymn. Matt Richardson's going to lead. We ask that you remain muted. It's also in the gray hymnal in case you have one. I realize that most people don't. It's For the Earth Forever Turning, somewhat familiar. It's hymn number 163 in the gray hymnal.
For the earth forever turning, for the skies for every sea, for our lives, for all we cherish, sing we our joy.